I was born at Quincy Medical Center when it was Quincy Hospital. It's where I gave birth to my own children. It is where my entire family and friends sought their health care for decades. It was always comforting to know that one day I would be able to seek care at QMC in my later years, but that will not happen. After a century as a nurse at the hospital, I was forced into retirement when Quincy Medical Center closed in December. What led to the closure of this 125-year-old institution, and what does it have to do with the legislation before you today, Senate Bill 623 and House Bill 979? First, I'd like quickly to review some of the things that led to the closure of Quincy Medical Center, leaving a city of nearly 90,000 residents and growing without a hospital. When Quincy Medical Center closed, it was on track to lose $20 million in the last year. And while there were some poor decisions made by hospital management that led us to this place, we cannot ignore the following facts. Hospitals such as Quincy Medical Center that have a high number of Medicaid and Medicare patients often can't and don't break even. This problem has gotten so bad in the state that now they can't even survive. Also, the hospital had seen a significant decline in percentage of private pay patients. These were being recruited away by wealthier hospitals for profits. In addition, because of some of the disproportionate sharing of Medicare and Medicaid, the hospital and community has suffered, and it has made it difficult for patients to access care. I'd also like to talk about the things that relate to the Hospital Profit Transparency and Fairness Act. The hospitals that took the private pay patients away from Quincy Medical Center did so at a profit and paid their CEOs millions of dollars. At the same time, hospitals like Quincy Medical Center were left to care for the working poor, many of whom are on Medicare or Medicaid. In addition, our tax dollars are going to both the wealthier hospitals and the less well-off hospitals. But in the wealthier hospitals, tax dollars are being used to boost profits and executives' pay. And in other hospitals, they are barely covering the costs of treating patients. There is something wrong with this system. These bills would address these problems by redirecting profits over 8% at hospitals that accept public money to go to a fund to improve Medicaid reimbursement rates for eligible hospitals. Also, requiring hospitals accepting public funds that pay their CEO more than 100 times what the lowest wage worker is getting paid to pay it into a Medicare reimbursement fund. And calling for transparency for all accounts held by hospitals, including those held on offshore bank accounts, so that we can see how much money these hospitals are not disclosing. More hospitals will close unless the existing inequity is fixed. This past year was Quincy Medical Center and North Adams Regional Hospital, a travesty to these much-needed communities. Next year, it may be your local hospital, and what we say to your community. Thank you for the opportunity to speak to you today. Please do the right thing for our hospitals and patient care and pass these important bills so that we can take steps towards reversing the dangerous trends we are seeing.